Hello everyone, so welcome back. This is Vibi. Before starting the video, I would like to place a request before you people. Please subscribe our channel, The Nightingale Tales. So let's dive into the video here about some few journal and both medical based questions for Navodaya staff nurses who are willing to get a staff nurse job at Navodaya institutions. So let's start. There are only 30 days to go. So I wish you all the best before itself. First question, lifespan of platelets is. We all know the lifespan of RBC is 120 days. So what is the lifespan of platelets? Platelets will have lifespan too. So that is 8 to 12 days. Within this 8 to 12 days, the concerned platelet will die for sure. Next, second question, profound mental retardation is seen in cases with intelligent quotient. So profound mental retardation, we all know mental retardation is a case where the person is mentally not good or mentally not stable. So those profound category, we all know that the MR mental retardation is divided into many types: severe, mild, moderate, and borderline, and profound. So if the patient has IQ less than 20, then it is called profound mental retardation. He comes under profound mental retardation category. Next, question number 3. What is the normal parameter of albumin levels in the human body? So the normal, all know albumin is a protein. So what is the normal parameter of albumin in the body? So that is 3.5 to 5.0 nanogram per dl. Next, fourth question. The cranial nerve which regulates speech and swallowing is. So we all know there are 12 pairs of cranial nerve. So what does this cranial nerve does? Every cranial nerve has its own function. So the nerve which regulates or which controls speech and swallowing. If we are speaking now and swallowing now properly, then the coding or the job is done by particular cranial nerve. So that is vagus nerve. So the 10th cranial nerve, vagus nerve, is helpful for speech and swallowing. Next, fifth question. Spleen is situated at the site of. So we all know that stomach is divided into 9 regions. The spleen, where the spleen is divided is, or under which region the spleen is located. We all know the spleen will be at the ribs, so the left side, so that is left hypochondriac region. Next, sixth question. The organ termed as graveyard of RBC. We all know that RBC lifespan is 120 days. So after 120 days, the RBC or the RBC cell self-destructs itself. So what happens is it goes to spleen and destructs itself in the spleen. So that is called autolysis. And we all know the meaning of graveyard. Graveyard of RBC is nothing but the spleen organ. Next, seventh question. The washing machine like murmur is felt in a condition of. We all know if the patient has any different conditions, they show different characteristic symptoms, particularly for particular disease. So if you listen to the heart sounds and the lung sounds through a stet or a stethoscope, if the person is having patent ductus arteriosus condition, PDA, so you can listen to the washing machine like murmur when you search for heart sounds. Next, eighth question. Chipmunk face is seen in, like, we all know chipmunks which just look like squirrels. Okay, if the person is having bulimia nervosa or bulimia anorexia, then the person's face will be like a squirrel. Next, ninth question. The light blue colored gas cylinders or pipelines used in the hospital system or operation theaters indicate which type of gas. We all know there will be different types of colored pipelines in the OTs or the operation theaters, like literally yellow pipe, white pipe, and blue pipe. And these pipes are responsible for transporting the required gases or the therapeutic gases into the operation theaters. So what does the pipeline or the blue pipeline actually indicates, or which type of gas will flow through it? So it is nitrous oxide. Nitrous oxide flows through the blue colored pipelines in the operation theaters. Next, 10th question. Who declared, or WHO declared, COVID-19 as global pandemic on? So it knows that only the first case of COVID came in the China and then the pandemic is declared. So after seeing all this contagious disease spreading from one person to one other person rapidly, so the depending upon its severity and symptoms and the spread through different areas in the regions and the countries, WHO declared COVID-19 as a pandemic on the date 11th March 2020. So here is the bonus question for you guys. So 11th question, the solution used to disinfect the surfaces in COVID treatment units is, which type of solution or disinfectant is used to clean the COVID wards or COVID ICUs or the COVID treatment units? So if you know the answer, please comment down in the comment section. I will reply you for sure. And don't forget to subscribe our channel, The Nightingale Tales. This is Bibi signing off. Bye.